Nephrolife soon entered a partnership with Davita Incorporated, a Fortune 500 company and the largest provider of dedicated renal care in the United States.
We have a network of centers that cater to everything from preventive nephrology to monitoring chronic kidney disease of a patient to dialysis, to also providing an ability for patient to undergo a transplant at partner hospitals.
Sriram Vijay Kumar is the dynamic young entrepreneur who inspires his corporate as well as medical staff to follow the company values of excellence, integrity, teamwork, compassion, continuous improvement and accountability. It is under his able leadership that Davita Nephrolife now has 15 dialysis centers for kidney patients in 7 cities across India, including Bengaluru, Pune, Chennai and Delhi among others.
We believe that our combination of clinical expertise and operational excellence allows us to provide the highest quality of care for patients on dialysis, and that includes the treatment, the processes, the service, the value-added features in our clinic set us apart. We work exceptionally well with nephrologists and with hospitals. We share a common vision and commitment to delivering care to patients. I believe we have structured wonderful partnerships across the country.
How tough is competition in the healthcare sector?
Healthcare can be competitive, but at the same time in India, there is the amount of patients who are not served is so large that I think for many years there is opportunity for everyone to grow and ultimately for patients to be the beneficiaries of this growth. Predominantly, we work more in partnership with hospitals and with other healthcare providers. So we view them more as partners rather than competitors because we are super specialized in the area of kidney care, which we look at.
What's the kind of technology that you use at all your centers?
We use machines from various world leaders in technology, and we also use a software platform called InstaHealth and TDMS, which essentially networks all of these machines together, which allows our doctors sitting in their cabins to monitor each patient session and all relevant parameters, such as their blood flow, their blood pressure, whether there are alarms generated in the machine on a real-time basis.
Through its RO plants at each of its specialized centers, Davita Nephrolife takes care to ensure that extremely purified water is used in all its dialysis machines. Its team of qualified nephrologists consults with patients daily and can monitor their data online in real time thanks to its state-of-the-art networked dialysis machines. The well-trained medical staff ensures that patients are provided dialysis in a clean and comfortable environment.
By and large, almost daily the nephrologist is seeing the patients, which does make us stand apart from the rest. We have dialysis medical officers who also look at the patients daily. We have a psychologist, dietitian. These are all in-house people, and in addition we have on-call, we have vascular surgeons, urologists. So our care is very consolidated and holistic.
Davita Nephrolife plans to expand to more cities around India and partner with major hospitals with the aim of becoming the premier provider of dialysis and kidney care. And with its investment in technology, dedication to patient care and innovative business model, it is sure to become the preferred treatment center for patients suffering from renal disorders.
Davita Nephrolife, you've pioneered the dialysis business in India and you built a pretty good brand while doing it. One of the concerns and one of the things you have to focus on going forward is the affordability of patients for your kind of care and the consequent impact it will have on your revenues and profitability.
Well, that was some sound advice for Davita Nephrolife from Bengaluru. Let's take another short break right now. On the other side, we'll travel to Hyderabad to explore a company that has state-of-the-art diagnostic testing and analysis facilities. You are watching India Mart Leaders of Tomorrow only on Etnow.
Here it is, what you're looking for, young man.
We make you find the right supplier for your business growth. IndiaMart.com.
Nobody knows it all, but we all know a little something. And if those little somethings came together, we could do almost anything. Like windows that turn sunlight into electricity. It may seem like magic, but it's simply chemistry. The same chemistry that can make plastic bags compostable and wind turbines more durable. Good connections today can make for a better tomorrow. That's why we don't just make chemicals, we create chemistry. BASF, the chemical company.
कैसी बातें कर रहे हो? अच्छा जी अच्छा, बाय बाय बाय.
हा हा हा, आ गया सीक्रेट एजेंट बनाए, जिसके दिल में चोर वो नो मोर. टीबू टीबू टीबू. हा हा हा, जिसके दिल में चोर वो नो मोर नो मोर. पकड़ो उसे, जिसके दिल में चोर वो.
चुप! गाड़ी छीन लो मत तुम्हारी.
पापा मैं तो बस खेली.
चलो बाहर जाओ, कुछ और खेलो. जिसके मन में चोर.
कहीं ऐसा ना हो कि बच्चों के खेल से भी आपको डर लगने लगे. सर्विस टैक्स VCS के चलते भरिए अपना सर्विस टैक्स.
Welcome back to India Mart Leaders of Tomorrow, only on Etnow. The next company we are featuring on our healthcare and biotech special has been providing holistic diagnostic services in and around Hyderabad for the last 32 years. Being a pioneer in the field, it employs world-class technologies and is run by qualified professionals today. Here's the story. When it comes to health, prevention is definitely better than cure. An organization that truly lives by this adage is Hyderabad-based Vijaya Diagnostics. Founded in 1981, this one-of-a-kind center offers a comprehensive range of diagnostic services, including radiology, nuclear medicine, and specialty lab services.
We are equipped to undertake from a simple investigations like urine examination to very special investigations like thallium scans, gallium scans in the radiology side. And we do a lot of high-end MRI studies like epilepsy protocols, headache protocols. And we also take a lot of special biochemistry investigations like cancer markers, where we can diagnose with few blood investigations some of the early signs of cancer.
Dr. Surinder Reddy is the enterprising radiologist who founded Vijaya Diagnostics when he realized that hospitals do not find it viable to invest in diagnostic machines. A specialized diagnostic center where patients could get all their tests done under one roof was the vision, going by which Vijaya Diagnostics has established 38 centers today.
The technology is most of the systems are fully automated, and to handle equipment we have highly qualified personnel working. Most of the people are well trained, and they do most of the investigation by themselves.
What are the biggest challenges that you face in this industry?
The patients are not that aware about the quality of diagnostic care where we get from a high-end center to a low-end center. And most of the labs are not NABL accredited labs. Right. In a medical industry, the diagnostic investigation is so important. If the report is correct, is getting a correct treatment. If the reports are not accurate, not reproducible, the treatment, whatever they're going to get, is not going to be accurate.
What are the new markets that you're looking at?
We're going to Gurgaon and Bangalore, Patna and Nagpur. And most of our labs, wherever we start, is going to be a comprehensive diagnostic centers. It's not like only pathology or radiology. We generally go with radiology, pathology, biochemistry, all under one roof.
The Department of Radiology and Imaging at Vijaya Diagnostics is one of the best equipped state-of-the-art departments in the country today. With its latest technologies, the company has a server whereby radiologists can access test results of patients of any of the 38 centers, thereby resulting in quick reports for them. The specialized clinical biochemistry lab is equipped with automatic instruments for testing, thereby avoiding human intervention and errors, making it one of the 800 labs in India to receive accreditation from NABL.
We give an access with a user ID and a password to our own consultants at various locations, and all of them would be viewing different cases depending on their ability, depending on their aptitude, and depending on their locations, and depending on the requirement of the system. Like if a person requires an urgent report, so we flash it with a different color. So the first consultant who is free in the queue will jump the queue and attend to that particular patient, irrespective of where is the scan done.
We run an internal quality control. Unless the internal quality control meets the requirements, we don't release the patient's reports.
Over the years, Vijaya Diagnostics has received numerous accolades and accreditations thanks to its investment in technology, well-trained staff and quality control measures. At a turnover of 80 crore rupees today, Dr. Reddy aims to go for a public issue for Vijaya Diagnostics to lead it to greater heights.
Vijaya, you've established yourself as the leading diagnostics chain in the radiology business in Andhra Pradesh. You're well known as a brand and your centers appear to be doing well. You need to be careful about the ROEs in this kind of business as you scale to the next level.
Well, that brings us to the end of this episode. Remember, if you're an SME entrepreneur, you can also be featured on this series. Also, watch out for the IndiaMart Leaders of Tomorrow Awards 2013 presented by Etnow. These awards will recognize and felicitate India's most promising small and medium enterprises across industry verticals. To know more about the awards, just log on to our website www.leaders.economictimes.com or feel free to email us at leaders@indiamart.com. Next week, we'll travel to some more cities, explore another service sector, and bring you some more inspiring tales of SME entrepreneurship. Till then, goodbye.
मुझे अपने बिजनेस के लिए 10,000 प्लास्टिक बॉटल्स की जरूरत थी।
मुझे 100 किलो फैब्रिक डाई की जरूरत थी।
मुझे 1000 हैंड टूल सेट्स की जरूरत थी।
मुझे 2000 पीसेस फैशन बैग्स की जरूरत थी।
इंडिया मार्ट के जरिए अब बिजनेस करना है आसान।
We make you find the right supplier for your business growth. IndiaMart.com.
A volatile global economy is posing increased risk for trade. How can exporters effectively mitigate their risk? Presenting ECGC DNB Export Risk Management Conclave 2013-14.
ECGC and its staff rededicate themselves to increase the risk awareness of the Indian exporters so that the overall competitiveness of Indian exports is enhanced.
Where this risk management conclave of DNB and ECGC has been planned, it is a very welcome news in the present volatile times.
Please keep the inflation of your debt under check. Don't take a huge amount of debt. Please listen to your banker.
A thought conclave with industry experts discussing and providing insights on 5 distinct topics linked to export risk management. Only on ET Now.
It's a long chain, and every generation is a link. You, your children, and your parents. They were there before you, and they will be there after you too. For generations to come.
Opportunity comes knocking every minute on ET Now. ET Now gives you more stock ideas from the best technical analysts every day and talks to the management of the most promising companies. Breaking stories that impact your investments. Make every opportunity a profit opportunity from 8 to 10:30 a.m. Only on Etnow.